Hi, What the HealthTech listeners. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care.
I was in the middle of having a heart attack. The surgeon said to me, 10 minutes later, Monsieur Murphy, and it will have all been over. But it kind of really brought my whole life into perspective. It's driven me to take the next step.
You can't ever take for granted women's health. If somewhere like the US can then make abortion illegal, no one's safe from it. You're not going to stop women having abortions. Women are going to have abortions anyway, but they're going to do it in an unsafe way and they're going to die, potentially.
We have a very open culture. We want to be honest, empathy for people within our organisation and external. And I think when you combine those things, that people then become passionate as well, because they're not just writing code for a piece of software that you're going to sell. They're writing code for a piece of software that's going to make a difference. And some of these differences are very tangible and, significant to healthcare outcomes.
Getting to know that family, those parents who'd lost such a young and beautiful daughter, quite needlessly, and to make matters worse, the way that they were dealt with really quite insensitively, that's one of the many sad incidences that have impacted on me. And of course, my colleagues who are doing the day-to-day work hear and see about many more. But Chloe has become one of those talismans for me that remind me about what it's all about at the end of the day and give us a passion for what we do.
Particularly in terms of health and the work that I do, if 80% of people are employed in the private sector, it is foolish to think that it is only the responsibility of the public sector to look after that 80%. Businesses do have to be in the room. They do have a role.
You listen to people speak. People are constantly learning, constantly evolving. We're doing it as an organisation. Our customers do it in their roles. And if I didn't take on board what was coming back the other way, how could we ever get better?
Obviously, the beauty of Radar is that it's so customisable, so configurable.
That is something I think we pride ourselves on at Radar, just being honest.
The core of it is about what we're going to do for the end user.
You always want to understand what the customer is trying to achieve.
It's an expectation that data should be kept secure, available and accurate. For me, those are the three key things.
So we quite often hear feedback about systems not talking to each other. Why do you think the industry still faces challenges like this?
We create this culture within the company, within the team, in which anybody can say anything.
Don't forget to rate and subscribe wherever you get your podcasts. And if you've got any questions for us, for any of our guests, please email whatthehealthtech@radarhealthcare.com.